Hi, thank you for visiting onephysiotherapy.com. My name is Leslie and I'll be taking you through the short video to show you the basic anatomy of the knee and some common knee injuries. The knee is truly an amazing structure. Probably the most injured in sports, it is capable of withstanding large amounts of forces and at the same time is much more flexible than you realize. So let's take a closer look. Firstly, the joints. We actually have two joints in the knee, the tibiofemoral joint, or the connection between the thigh bone, or the femur, and the shin bone, and the tibia. That's the tibiofemoral joint. The other joint is called the patellofemoral joint, and this is connection between the kneecap, or the patella, and its underlying joint surface. Essentially, the knee is a curved surface sitting on a relatively flat surface. And this unique structure is responsible for the knee's flexibility. It can move in several directions. The most obvious movement is flexion and extension. And then there is forwards and backwards gliding on the knee. And lastly, the knee can actually rotate up to 70 degrees. Because of the knee's flexibility, it needs other structures like ligaments, muscles, and cartilage to hold it all together. So now, let's talk about these three structures separately. Ligaments are passive structures that do not contract. Think of it as rope in that it does not stretch. This is an example of a ligament. They connect one bone to another bone and are usually injured when they are overstretched, like this. The pain is sharp, very obvious, and usually involves swelling. For example, on the football field, it may be caused by a collision between two players. Or, alternatively, it could be a twisting type of injury as they change directions. Once injured, the pain and swelling usually goes away in about 2 weeks. However, depending on the severity of the injury, people do report complaints of looseness, instability, or giving way. Now, let's take a closer look at the ligaments inside the knee. Now, if we look at the front of the knee, deep inside, we have a ligament called the ACL. And this is called the anterior cruciate ligament. On the side of the knee, we have the MCL on the inside, called the medial collateral ligament, and the LCL on the outside, called the lateral collateral ligament. And lastly, at the back of the knee, if we spin it around, we can see what we call the PCL, or the posterior cruciate ligament. Now, the ligaments aren't the only thing that hold the knee together. You also have some very big muscle groups that play an important part. At the front of the leg, you have the quadriceps, and at the back of the leg, you have the hamstring muscles here. And both these muscles wrap around the knee and help control knee movement. Now, we know for a fact that weakness in these muscles can lead to pain and higher injury rates. So if you're playing sports, anything from jogging, football, basketball, rugby, and netball, it's a good idea to do some lower limb exercises and strengthening program once or twice per week. Lastly, let's talk about the cartilage in the knee. The knee has two important structures called the meniscus. These two disc-shaped structures act as shock absorbers, kind of the same way the suspension in your car helps to absorb the shock. The meniscus usually gets injured in much the same way as the ligaments, involving a twisting type of movement. But, unlike the ligaments, injury to the meniscus involves much less pain and much less swelling. People tend to report discomfort deep inside the knee, as well as stiffness and giving way. However, this does tend to resolve after a few weeks, but more often than not, surgery is indicated and warranted once a correct diagnosis is made. Now that we've talked about the ligaments and the cartilage, we're going to look at some common non-acute injuries that people get. These injuries usually start slowly and gradually build up as people start to increase their training or start a new sport or activity altogether. The most common knee injury is called runner's knee, or is more technical in term, chondromalacia patelli, but we will call it CMP for short. The pain usually occurs anywhere around or even behind the kneecap itself, and it's caused by the result of compression or friction between the kneecap and its underlying joint surface anytime you put force or weight through your leg. The most common complaint is running, jumping, and going up and down stairs. So, why does it happen? Well, the kneecap has a thick layer of cartilage that protects it, and this allows smooth gliding. But sometimes, certain factors can increase the amount of friction of force going through the kneecap. If the kneecap itself is small, the force will be concentrated in a smaller area, hence more friction. Other times, tight structures like this thick band on the outside of the leg, called the ITB, can pull the kneecap outwards just enough to affect the alignment and hence cause more friction. Lastly, there's the issue of being flat-footed. You can see here, if our model purposely drops the arch of her foot, the angle of the knee actually changes. As the angle of the knee changes, it affects the alignment of the kneecap. And again, this can cause CMP pain or kneecap pain. But whatever the cause, physiotherapy can make a big difference, and it might just take 1 to 2 sessions. The last type of injury is called jumper's knee or patellar tendonitis. It's much less common than runner's knee or CMP, and it's a result of inflammation of the patellar tendon, which is found right below the kneecap, this structure here. The patellar tendon is simply a continuation of the massive quadriceps muscle as it attaches into the shin bone or tibia. It's often confused with runner's knee, and the main feature is pain when you press the tendon or when you squeeze the tendon. The causes and symptoms of jumper's knee is very similar to runner's knee in that people complain of sharp stabbing pain below the kneecap in this area. And also, like runner's knee, the treatment is very similar as well, and physiotherapy can make a big difference. Well, I hope you found this video informative, and thank you for visiting onephysiotherapy.com.